Oh, snaps!
The world is finally waking up to the crap that's baked into and sprayed on kibble dog food. No longer can commercial pet food manufacturers fool us with pretty pictures and false promises. This is the raw dog food truth. The view and opinions expressed on this podcast are not intended to replace medical advice. Before starting any raw diet, do research, ask lots of questions, and consult your vet. Well, hello, raw feeders. I'm Dee Dee Mercer-Moffitt, CEO of Raw Dog Food and Company, where your pet's health is our business. And we're friends like my friend, Dr. Judy Jasek out in Tennessee. Well, she doesn't let friends feed kibble. How are you, Dr. Jasek?
Doing great. I'm finding that my pace has slowed because I got planting done and now it's getting warm here. And like, gosh, I got all this free time because, man, I was hustling the last 3 months getting everything in, March, April, and May, just plant like crazy. And it's all new area, so I'm putting in fruit trees and shrubs. And now I'm going to the osteopath to get my back healed up from all that digging and squatting and
Oh, good for you.
Weed pulling and all that. So yeah, started. I don't know. Are there osteopaths for animals? I don't know. I mean, there's chiropractors, but I don't know if there's people that do osteopathy actually on animals, like as osteopathy is done on people. I don't know.
Well, I don't know, but I will say this, that chiropractors like Dr. Andy understand cranial sacral adjustments in dogs. So, if they're good and they've been doing it for a long time, maybe they do. So when Lozzie goes to see Dr. Andy, and Dr. Andy always makes it a point to say, I did do a cranial sacral adjustment on her today.
That's what you want.
Yeah. And, it's you and I were talking. I'm really very curious and hoping that as we send this out into the universe and as you and I study the works of Daniel Roytis with the Bigglesons, with the Baileys, Kaufman, Cowan, all of these different people. And I'm getting introduced to even more people, more doctors, more people as I listen to these podcasts on the terrain theory and more real information about it. And I think what's really exciting, and I'm going to come back to what my original thought was here in a second, but what's really exciting is that they're pointing out there is no scientific research that backs up germ theory.
Right. Never
And
has
we're
been.
like, what? And they're, and every single one of them say this, Dr. Jasek. If you can provide the information that will show that there is actual causation and correlation and research that would show this bacteria, this germ, this virus, right? This virus mainly is what we're talking about, I think. But even bacteria, the way it's looked at is different. They're like, we'll recant everything we've ever said. Because the issue is this: if you point out and if viruses don't exist, which is a tough one for so many people, so that's fine. You knock out every vaccine there ever was.
Yeah, the whole industry. And that tells you, like, when I first heard that from Dr. Cowan, this isn't that many years ago, like 3 or 4 years ago, that viruses don't exist. And I'm like, oh, come on. But then, the evidence that he presents among these and these other people is very convincing. And then you think about it, well, why would this narrative persist? Well, follow the money. How many billions are made, not only in veterinary medicine, but in human medicine? Children get 75 shots by the time they are school age or something. It's ridiculous. How many billions and billions of dollars and the kickbacks that pediatricians get paid by the pharmaceutical companies, and they get like bonuses. Something I've heard Dr. Larry Palevsky say this because he's a human pediatrician. And it's something like if a certain percentage of their practice is vaccinated, like the kids in their practice is vaccinated up to a certain percent. I don't remember the exact number, but then they get kickbacks. So that's the motivation. It's all about the money. It has nothing to do with health.
Right. And back to what my original thought was, that hopefully with all of these contacts that we're making, we can do this live blood analysis, not the dark field stuff that's going on out there where people are saying, oh, this is the graphene oxide, this is the graphene that's coming from the mRNA vaccines. The Bigelsons are very clear on, they've been seeing those cells for a long time. That is not graphene oxide. That is a worry cell, and they've been seeing it for 40 years, and other folks have been seeing it for longer than that. So there's a lot of misinformation out there, again, or a lack of education on understanding what they're actually seeing. But it would be interesting to see what actual blood, not CBC, not the blood panels that we see in dogs right now, but actual live blood cells that says this is what is bugging the body. This is what the body needs to look at. And what I would like to see is the blood from a dog who is raw fed, clean water, no vaccines, no flea and tick, no pharmaceuticals, whatever. What does that blood look like? Okay, because there's still other factors, Dr. Jasek. There's still EMFs, there's still the energy within the home, which is part of the terrain, right? There's
The
other
emotions, yeah.
factors. Yeah. But then I would like to compare that with a dog who is loaded with all that other stuff and see what the blood actually says.
Yeah, that'd be really interesting. And it probably will be individual too. Like you could take 3 dogs that have gotten all that stuff, all that conventional stuff, and their bodies are going to be reacting in different ways. Different things are showing up. Like I always tell my clients that there's kind of a weak link in the body. Like if the body gets inflamed, some dogs are going to itch, some dogs are going to get diarrhea, and like the body's trying to resolve the inflammation in some way. And it's different for every animal. And I bet you could take, dogs under similar circumstances and different things would show up in their body. It'd be fascinating. I'd even sponsor some cases if people like wanted to do that. I'd love to see the Bigelsons, like what their take on some of these cases. If we could figure out how to get the blood, because you need to get a drop, humans, you poke your finger. So people would have to poke their pets to get the drop of blood.
And you and I were talking about this. You could poke the tip of the ear and get it.
Yeah. Yeah. So sometimes people like the animals that are diabetics, they'll check, because you can buy little, glucometers to use at home. So people don't have to keep running to the vet to check the blood glucose. And the ears, like if you look at the tip, like the ears, the skin is real thin and you can actually see little blood vessels running. So if you just kind of poke like right where they're small, like they're not going to bleed a lot. But just to get a drop of blood, because everywhere else the skin is kind of thick. Another place is like underneath the tail, underneath like the base of the tail, kind of right above the anus, there's some little blood vessels there. But still, that's no guarantee the pet's going to hold still for that while you get the drop of blood. But it could be done.
Can you get it out of the pad of the foot?
Well, they're pretty tough. Like their pads are pretty, like have like basically a big callus. So you'd have to poke like by the nail bed, like maybe in between the toes or something like that. So it could be done. Just a little easier. Now us, like we'll just torture ourselves, say, okay, this is going to hurt a little bit, but I got to poke my finger. But you got to get the drop of blood and get on a slide and all of that stuff.
Well, so I've been doing acupuncture, and sometimes I will bleed. Like she'll put one of those little needles in my ear, right? Or depending on where those needles go, and they're tiny. They're tiny, tiny needles. It's really weird because she'll put all those needles in and then she'll walk out of the room, right? And let them sit for a while. And depending on where one of those needles is in my leg, like it's painful. It's weird. Like it's like a I don't know. It's like a wing, like a ting. if you
Yeah.
move your ankle around, I guess it's sitting on one of those meridians or something. I don't know.
Yeah. Well, there's actually nerves, because they've studied this, because they teach in veterinary medicine, even up at CSU, they teach an acupuncture course, but they teach it not from a Chinese medicine perspective, from a like neuroanatomical perspective. So they've looked at what is at these acupuncture points, and there isn't actually a concentration of nerve endings. And they say, like, if you need that point, if that point is like the points can be like overactive or underactive. And if it's overactive and those nerve endings are irritated there and you put the needle in, then it can't irritate it. But then the acupuncture can sometimes help calm that down too. So they've actually looked at, it's not just on a purely energetic basis. They've actually looked at, well, what is in these points? And it's nerves and blood vessels. So yeah, it could if the point's active, could bleed a little bit more, or more likely to bleed too.
Yeah. So speaking of cancer and cancer in dogs, you had sent me this ridiculous thing that people are looking at. There's a new test. Gosh, just a new test to bring in more stuff. But this test, we want our listeners to be familiar with. It's called Oncotech, right? Oncotech. And what is this, Dr. Jasek? This is some type of a cancer thing. And, you know, you and I, what we're learning about cancer, what we're learning about metastasis, what we're learning about cancer cells, again, is one of those things that is turning everything on its head. But people fall for this all the time, right? So this is a test that tests dogs for cancer cells. I mean, what does that really even say?
Yeah, I think it's completely bogus. And you know it I always look at the creative marketing on these things too. Number one, this is something that pet parents can do at home because it tests the urine, and it's for early cancer detection. So before you see a tumor, before you do any other testing, or your dog's apparently healthy and you want to know if there could be cancer lurking somewhere in its body that you haven't found yet. Well, what it is supposedly is you take the urine and they test it. They have like some little minute nematode, like a little bitty little worm, just like a couple millimeters or something, that is supposed to be more attracted. So the theory is that cancer cells emit certain chemicals that these little worms are attracted to. And how they know this, I have no idea. Like it sounds so far-fetched. I can't even believe it. But so they take the dog's urine and then they expose the little worms to it. And so I think you just collect your dog's urine and send it in. And then if the worms do this certain behavior in the dog's urine, then that shows that they're reacting to the chemicals that are emitted from the cancer cells, which is then supposedly shed in the dog's urine. But it's like, you read about it and it's just that vague. Like in the studies, they studied, like, I don't know, maybe a half dozen different types of common cancers. And each study group is like less than 10 dogs. Like,
Oh my.
it tells you nothing. I mean, it tells you, and this test is expensive. It's like $300 or $400. It's not cheap. And then what's going to happen if this is positive? Well, these poor pet parents and the poor pets are going to be in at the vet, and then they're going to be spending thousands of dollars more on tests, on more, blood work and x-rays and ultrasound, because this test showed that my dog may have cancer. So we got to go looking for it. To me, it's just a way of trumping up a bunch of unnecessary vet bills, creating a lot of fear and putting the pets through a lot of unnecessary procedures. Like, let's just go back to focusing on healthy terrain, keeping the pet healthy. People say they can't afford raw food. Well, you could, if you weren't doing these tests, you could probably buy at least a month's worth of food, for your dog, rather than doing this test that means absolutely nothing.
Yeah, and as we've said over and over again, and the Bigglesons, who study all types of blood and issues and working with people and what is disease, what isn't disease, all of these folks, the theme over and over again is feed the body appropriate, stop poisoning it, and get joy, right? And
Yeah.
structure. So, structure again is super important when it comes to dogs. I mean, you've got Rex, who's now 4 months old, and they're moving and grooving and running and, throwing their body out of line, who knows how much, right? And I know that in some places, chiropractic for dogs is not available unless you go through a vet. Um, but I do believe that structure um, is important for dogs, but then feeding them a species appropriate diet and I'm sorry, but kibble is never going to be species appropriate. That is
Mhm.
processed food, and if the ingredient list is long, you need not feed it. Um, then you want to make sure that you're feeding clean water. And you and I were talking about this before the podcast. You know, we have our water delivered from a spring in glass jars, right?
Mhm.
And we're on a well here. But I was talking about going down to our gym and the water fountain that's there. If you hit the water fountain button, you literally can smell the chlorine in the water.
Yeah, that's awful.
And I'm not sure that pet parents really see how much stuff or really understand how much stuff is in water that could be affecting your pet. So that's another level that we want to look at of not poisoning your pet, not giving them water that has all these different chemicals and fluoride in it. There, as you and I are hearing, there's so many simple ways to keep ourselves healthy, keep our pets healthy. We tend to not do that. I was watching somebody give their dogs puppuccinos the other day. I was just like,
Ugh.
why do you give your dog? Certainly, there's this chemical reaction that happens in pet parents when they give their dog treats, when they give their dogs food, they think they love it, and of course, most species are going to love high sugary things. And so there's this, oh, I love doing that, but it's not good for your dog. Yeah, I cringe every time I see
Oh,
that.
it's awful. It would just at least, feed healthy treats. If you want to give them something, feed them something healthy. That stuff is such garbage. And then people are shocked when their pets get cancer. Like, well, I thought I was taking good care of my pet. And a lot of times people really truly do because they're going by what their vet told them. And they did. I mean, I would say by far 95% at least of the new cancer patients I work with have been down the conventional road. They've been, vaccinated per their vet's protocols and kibble fed. Some have had healthier routines than others, but still, there's usually still you can identify a high level toxicity. This is where it comes from. We have to stop doing it. You have to start, pushing back against the mandates at your vet's office, like we've talked about. You gotta stand up for your pet and not keep poisoning them.
Well, what's the typical protocol, Dr. Jasek, when a dog goes into the vet and they're diagnosed with cancer? What's that typical protocol?
What pet parents tell me is that usually like your average, like just general practitioner vet, they don't want anything to do with them at that point. It's mostly, I'm sorry, you can try prednisone, go see an oncologist. They throw steroids at all tumors. I have no idea why. So we got this compromised, likely toxic body. So let's start to suppress its immune system. Let's just throw them on steroids and see if that helps. Maybe they throw in some antibiotics for good measure too, but they really don't know what to do. They certainly don't talk to them about nutrition. And then it's kind of like, I'm really sorry. You can go home and watch your dog die or go to an oncologist is sort of the nutshell response that people get. People aren't given options, certainly no hope. And and oh, by the way, your pet's due for its rabies shot, so let's do that while you're here. They'll just vaccinate them. I can't tell you how many patients I see that are vaccinated sometimes, well, a lot of times right before their diagnosis, which is no surprise, or even after they've been diagnosed. They're still pumping the vaccines into them. So the vets have no clue where this comes from. And it's, there's no empathy, no talk about nutrition, no nothing. People are not given any options. And then they go, home and consult Dr. Google and then go down all different types of rabbit holes. That's usually what happens. And it's sad, like, I don't know, like the people that don't find people like you and I that can present to them other ways of doing things, probably just either let their pets die or they go the conventional route through the oncologist.
Yeah, it's unbelievable to me the protocols that are used that are standard of care, right? And you and I were talking about this as well. And yet people like Dr. Billson or any holistic person or any doctor that would say, I can cure cancer or I've cured cancer or this helps cancer, they can totally have their careers ruined. They can be thrown in jail. And that is should be a wake-up call. Why? Why would that be not allowed? Why? And the only reason is because it is a billion, gazillion dollar industry.
Yep.
And we
Yep.
cannot allow pet parents, the human being in general, to have this knowledge so they do something else.
Right.
And it's beyond me.
And
That,
people should have that choice. If they want to go to somebody and try
right?
some treatment that nobody else has heard of, it should be their decision. It's their bodies or their pet's body. They should have that choice. If they want to do something that's not not conventional, quote unquote standard of care, it should be their choice, and as long as the practitioner is informing people, say, this is, this, treatment, whatever it is, and this is how long I've been using it, and these are the potential benefits, and these are the, potential downsides, if any, as long as they're well informed, it should be their choice. They shouldn't be jailing, practitioners. Practitioners used to be able to talk openly. That's how practitioners learned, is they could talk openly, like, hey, did you hear about this new therapy or that new therapy? And they could talk to each other and compare notes. Like, they don't even encourage that kind of open dialogue. It's just, algorithmic. Like, this is the diagnosis, this is what the lab work shows, this is the approved treatment, and that's what you do, and you don't deviate from that.
Right. And a lot of these podcasts that I've been listening to with people who've either gone through a portion of med school or all the way through med school, and then somehow they've been able to not be indoctrinated, right? They've been able to look at it and say, this makes no sense. This makes zero sense, and there's no way that I can affect health in a big way if I go down this path. And so they get out and they go a different way. But at the moment, all we have, I think, are a lot of people waking up, which again, I think COVID did that. That was one good thing that happened, because now you're seeing, you know, Fauci, you know, they're questioning Fauci, and they're calling him Fraudchi, you know, Mr.
Yeah,
Fraud, because he is. And
totally.
if you really look at all of that stuff, I remember people could not believe that we were saying that he was a fraud back in the early days. They were like, "Oh, he's this and he's that." And I'm like, "Okay, but maybe you just haven't been exposed to the information." Right?
Yeah.
And that's really sort of the key, is you got to be exposed to that information. And once you start seeing it, then it is a little disorienting, because we don't have these big facilities that you can go to for alternative treatments.
Right.
You have to seek those people out, like yourself, and like some of the people that we've been introduced to. But I do believe if you get on that path and you start looking and you ask for help, you will be led in a different way. And there are going to be times with your dog, with your cat, with your horse that you're in the situation of, I don't want to lose them. And you have this sort of knee-jerk reaction. You want to jump back into the traditional way. And I think that you've got to have a good team around you so that you don't do that. Because when you get afraid, like we've talked many times, you can tend to go back the other way. And
Yeah.
then what's the alternative? Poison, surgery, and radiation.
Yep. Those are the only things that they have to offer you. And those are all considered standard of care. So even if it harms your pet or kills your pet, it's, it's still acceptable. Whereas the other, alternative ways of treating, are not considered, I don't know, valid or effective, even though we see pets live much better quality of life and oftentimes go much longer than what the, conventional predictions would be. I mean, cancer is tough. I mean, by the time we're treating cancer, we're pretty far behind the ball. We're starting behind the ball, something's been out of balance for a while. And so there's a lot to correct. And, if a cancer patient comes in and they're already not eating, and especially if they've been through the conventional treatments, so their body's really run down because of that, and they're kind of coming for holistic care, sometimes it's like a Hail Mary pass because they've already done the conventional stuff and that didn't work. Those pets are pretty run down, at that point. So there's a lot of catch up to do. So the point is we need to stay ahead of it. That's why it's important to, don't wait for that, wake up call, like be doing things to keep your pet's body healthy. Now get them, spend the money on the raw diet, and don't be poisoning them with the vaccines. Don't, a lot of people wait until they get the diagnosis and then they're in a panic, and now I gotta do stuff. It's much better to start earlier, start when they're young, do the diet from when they're a puppy, do the body work, keep their spines aligned, do all that stuff. And then you don't have to go down the road. You don't have to worry about, what happens when, you get the cancer diagnosis. You won't have to go there, or it'll be a lot less likely that you have to go there.
Yeah. Yeah. And again, I think there's a bridge that I haven't figured out yet that helps people if they are of the mind that, yes, I'm giving these vaccines and I'm doing the flea and tick and I'm doing the heartworm because I want to avoid what could happen, right? That's
Mhm.
that's the reason that it's done. There's a lack of there's a bridge that I haven't been able to actually figure out yet to help them maybe see that there's a lot more danger with the traditional way. There's just a lot of danger in doing that. And will your pet get heartworms? Does your pet really get Lyme disease if a tick bites them? And is there really such a thing as rabies? And one of the things that I've been listening to are some of these folks that say they talk about how they're trying to learn how to talk about it so that people don't just shut down, right?
Mhm.
And I think my personality is I just want to tell them and
Mhm.
hope I just want to come at them straight on. I'm not sure that's the best approach. Because, people are like, what's your evidence? And, or they'll say, well, somebody in one of my family members' dogs got heartworm and it was terrible to treat, And I get it. I adopted a dachshund
Hmm.
that had heartworm very, very early on, and this dog went through the treatment, and then many years later was getting his teeth cleaned and died on the table. Now, you and I have talked about this, where I don't know if that was due to the fact that he had weak lungs because he had heartworm. I think what you had said is when they go in and get their teeth cleaned, somebody missed monitoring the oxygen level
Hmm.
in him, right? That was probably more the case. And he did die getting his teeth cleaned.
Hmm.
Um, and he was 12, right? But I don't know. Are there natural solutions to heartworm other than that very toxic chemical protocol that they do?
You mean to treat it like once
Yeah.
they're
Yeah.
tested? Yes, I mean, there's several options. There are some herbal options. There's a company called, let's see, I think it's Amber Naturals. They have
Oh, yeah.
different like herbal formulas, and they have this, it's HWF. I think they actually used to call it heartworm free, but they got in trouble for saying that. So it's healthy, their healthy heart formula, whatever. So you can put pets. I've seen people put pets on that and treat per, their dosing instructions and treat until they test negative. Um, I also now question the testing. I question all testing now. They're testing
Right?
for
It's like,
something. What are they testing for? And is that legit? Now, I have seen some dogs that test positive for heartworm that, I mean, you can actually see the worms in the heart on something. You do a echo, and dogs that have really bad infestations, you can actually see the worm. So I do think that's a real thing. However, I think the dogs that get that sick, again, their terrain has been damaged. I don't know, your dachshund, was it a stray? I mean, was it a rescue when you got it with heart? Did you get it with, they come with heartworm?
yes, yes, it was running around the neighborhood, and I found out that this dog had been abused, and so I actually was able. It had the veterinary tag on it, and
Mm-hmm.
when I called them to try to find out whose dog this was probably unethical at the time, but I'm glad they did it. They let me know that this dachshund had been brought in several times, and that they knew that this dog had been abused.
Mm.
So I took him. His name was Neo. I named him Neo after the Matrix, but he was a great little dog. And actually this family drove up and said, "That's our dog." And I said, "Not anymore. I know
Mm.
that I know that you've abused this dog." And they actually said, "Well, it was my granddad that did him. He would beat him with the 2x4." And I was just like,
Oh, geez.
"Uh-huh, you better get on down the road."
That's right. That's right.
I was,
So,
yeah.
so anyway, most dogs that, I mean, almost always, I can think of one case that I remember where a dog like that was already in a good home, healthy diet and everything, tested positive for heartworm. Now, again, what does that positive test mean? But the majority, I mean, 99% of the heartworm cases, they come out of the rescue. So these are dogs that, been like out on the street. They've either been emotionally or physically abused, poor nutrition. So these are really, I mean, like very poor terrain situations. And that's where it's showing up. I think the likelihood of it showing up in a dog that is getting really, really good care is very slim. But anyway, back to your question. So there's this herbal blend that you can use, but it's also a reported treatment that you can just do, like the conventional, like Heartgard is ivermectin. I mean, that's the thing that actually ivermectin can kill the heartworm larvae. And you can start a dog on like a low dose of ivermectin every month, just like you would do the preventative, and you just allow the worms. It doesn't do like the fast kill. So the drug that they give kills the worms off really fast, and then you get these dead worms living around the heart, and they break into pieces and they go through the circulation. The dogs get really, really sick. when you just give that lower dose of ivermectin every month, you kill off the larvae. So you keep the infestation from getting any worse. And then you just kind of let the adult worms die of old age, essentially. And then the body can process and eliminate them more gradually, as long as the dogs are not symptomatic. These are dogs that are not showing any signs. They just go to the vet, they get the blood test, and then you treat them until they test, until they test negative. So yeah, there's definitely other options. But I talk to people, here in the South, people that don't want to do the heartworm prevention, and the people just don't worry about it. I mean, I'm in that camp. Like, I'm just not going to worry about it. I just feel like I keep my dog healthy and, with a good diet and a healthy lifestyle, and he's out digging in the dirt and eating toads and God knows what else. He's going to have a strong immune system, and I'm just not going to worry about it. And the clients that I have that attitude, I mean, they might still get their dog tested every now and then. They never test positive, but I can talk to other people in that same geographic area. Like, oh my gosh, well, heartworm is a big thing here. We got to do the heartworm preventative. So they're living in fear. And I think that just puts the dog at more risk. I just feel like if more and more, if we just keep their terrains healthy, but including the lifestyle, it's not just the nutrition. It's are they getting out and getting good, healthy exercise, getting to run around, getting to play with other dogs, and all of those things that are healthy. Dogs are not humans in dog suits. They need to live a life that that a dog would enjoy. Herding dogs like to herd things, so getting out and kind of expressing their uniqueness or whatever it is that they like to do, that's really super important. And I just feel like if you do all that stuff, you just don't have to worry about all this other stuff. It's just all kind of made up to create a bunch of fear and sell a bunch of drugs.
Well, and the germ theory suggests that there are germs waiting to attack you. There are viruses waiting to attack you, right? There are these things. And I would encourage everybody to seek out Dr. Daniel Roytas, Roytas. His book is called Can You Catch a Cold? And he goes through all this. There's another guy that I just started listening to, and I'll have to get his information, but he's written books. Everything is upside down, like Upside Down Medicine, upside down
I
this.
just
Upside
started
down.
listening to that. Mark Gober. I just looked it up.
Yes. Yes.
I ordered his book. I just started listening to the podcast. So I'm not very far into it, but what really intrigued me about this guy is he has no medical background.
Yeah.
Like, he's on board, I think, with what we're talking about and the terrain theory and what Daniel Roytis talks about. But he's picked from a tech background. He just started investigating. So when you talk about, like, how do you talk to people about this? I got his book, or I ordered, actually I got the audiobook because I can listen while I'm driving around and stuff. But I'm really interested to hear how he came to these conclusions, because he has he's not treating people. He's not influenced by the medical system. He has no ties to the medical system whatsoever. But he just logically went through and started looking at the evidence that he was finding and came to these same conclusions. So I think I'm really curious to listen to his book and to see how he came to these same conclusions from somebody that has, no medical background.
Yeah, it's amazing. I love that podcast. I really do. They've got some great guests on there. I like the host, Ben and whoever the guy is, but it's called Terrain Theory. It's really, really good. And then Dr. Kaufman, the Baileys, the Bigglesons, Amanda Vollmer. There's a lot of them out there. There's another girl, and I've got to find Ayurveda is her name. They talk about her. She's the one that does a lot of like Dr. Emoto's work, I think, and carries on his work of how water has a memory. And
Yeah, the Bigglesons interviewed her. She participated in one of their webinars or something.
I have to go back and look at that. Iveda Austin or something like that, or whatever her
Mhm.
name is. I've got to find her, but um, there's just so many things that I think we can do to improve our health, to improve the dog's health. And I do believe that if we improve our health, then the terrain of our pets also, right,
Mhm.
is healed, or there's an advantage to that. Because if we have a toxic environment, we have to remember that our home, even a daycare or a boarding facility, and I would say if they're going to a daycare or a boarding facility, they're probably going to be subjected to chemicals in the body,
Mhm.
because that's what these facilities require. So I don't take my dogs to those places. So I would say that terrain is probably not going to be the best for your dog. Now, here's the argument. People can say, well, but my dog loves it and they need to get out and play. Okay, that'd be like saying, my child loves to go to the playground, but I give them a dose of mercury, before they go to the playground because that's what's required.
Right.
Okay. Is that going to be good long term? Is that good short term? Right.
Right.
So we kind of have to look at this, and I'm not certain why and how we got to the point that said poisons are good for the body.
Right. Because I think the medical system has encouraged people to be afraid of the germs out there. Be afraid. This is the whole germ theory that we have to be afraid of the things out there that are waiting to attack us and waiting to attack our kids and waiting to attack our pets. And people are afraid of that. And well, if you just go get these vaccines, then you can take care of all that fear and you don't have anything to worry about. But people don't think about what happens on down the road with the cancer and the different diseases. I mean, just the inflammation. The body is just inflamed and toxic. We see so much lymphoma these days, more and more and more lymphoma diagnoses. And it's just extreme inflammation. The lymphatic system drains toxins. It cleanses the body. You hear about things like lymphatic massage, keep the body able to drain and detoxify. Body gets overloaded with toxins. The system can't handle it. It just gets overloaded. It can't detox anymore. And then that's what we call quote unquote lymphoma and these big lymph nodes are. The body just is overloaded with toxins. But the time to act is before, your pet gets to that point. And sadly, the vets tell people, oh yeah, the vaccines are safe and they're not going to hurt, they're, not going to do any harm. And oh, by the way, you have to, if you want to keep coming in here, people need to start pushing back and looking for options. And so sure, you want to take your dog to daycare, ask if they'll accept no-sodes or ask if they'll accept a titer test, or educate them about other options and create a market for them. If they're not requiring those things, it could actually be a good business move for some of these facilities if they're a little bit more open-minded.
Sheesh. Wish on. But the you got to wonder, Dr. Jasek, and I think you've been wondering about this for a while on lymphoma. Um, the only way for the body to drain and get these things out is through the lymph system, right? And if they take your lymph nodes out, how in the world can you heal? How
No.
how is that going to be helpful?
You can't. And when those cancers come back, if I see a patient or like they've had a tumor removed and they've removed local lymph nodes, because the conventional approach, they'll see the tumor, they'll do a needle aspirate or a biopsy and determine, okay, it's cancer, we should remove it. Then they stick a needle in the lymph nodes and find the same cells there. Well, to me, that's just the body doing its job. It's draining those, toxic cells out of the body. It's trying to get rid of them. But conventional medicine says, no, that's metastasis. That's the cancer spreading. You got to get rid of those lymph nodes. And then that area is so compromised because not only do you have compromised circulation from the surgery, you're going to have scar tissue, and now you have no drainage. There's probably about a 90% chance that tumor is going to regrow. and then you're done. You can't, there's no treating it at that point. The body, the body's defenses cannot get in there to treat that area. So yeah, removing lymph nodes is a really bad idea.
On that note, before you go, there's a question that came up, and let me see if I can find that question. So, Brian sent this one over, and he was asking the question. I think we've answered this quite a few times, but let me just see if I can get to this. This is going to be on cyst and removing cyst in the body. So, this particular pet parent said, my dog has a sebaceous cyst, and I was wondering if there are any supplements or recommendations for this. I I like I like turkey tail, I like mushrooms. What else would you say? And would you say remove these cysts or not?
I don't recommend just going in and removing them unless they're like in some way like really problematic for the dog. Like sometimes the dog is scratching them and they're bleeding and they create these nasty open sores. But I'd still use removal as, a last resort. The groomer keeps nicking them with the clippers and stuff like that. But first, I would definitely, make sure the terrain is healthy. I've had so many people tell me, I changed my dog to the raw diet and used to have all these cysts and all these lipomas, and they're just going away. So again, look at the terrain instead of focusing on just that cyst. Look bigger picture. Does the dog have a healthy terrain? Correct diet. Are we not poisoning? Stop vaccinating. If you keep vaccinating your dog, well, this is just how that toxicity is manifesting in the body. And if you're not correcting the imbalances and correcting the terrain, they're just going to keep getting them, so don't put them through, surgery until you're correcting all the, other underlying issues. So stop poisoning them, correct the, mental, emotional terrain and all of that. And then you could try some topical things. I've used ozonated olive oil. I've used some essential oils like frankincense. I know if you want to talk about turpentine, but we've been experimenting with turpentine on our skin. I have no experience using turpentine in dogs. So,
and not the turpentine you can get at Home Depot. We're not talking about that.
not the stuff you get at the hardware store. This is, I don't know what you call it. I mean,
it's
you
gum
get the
spirits.
bottle, it still has all the warnings on it, like may irritate your skin and don't drink it and all that stuff. But it's a solvent and it has a lot of health benefits. And the first time I heard that, I'm like, turpentine, like you got to be kidding me. But you've seen the effects on your skin. And I'm experimenting with it on my skin because I do experiment with stuff on myself before I recommend it to my patients, because I want to make sure that I'm, that I've used something or I've experienced it either on myself or on my own pets before I would recommend it to my patients. But so, I mean, there's some topicals you could try.
On the turpentine, we get that from Dr. Thomas Cowan, and it is, if you can think about it like this, the way that maple syrup comes out of a tree, okay? It's the terpenes that come, like the turpentine that comes out of the tree. So it's a natural gum that comes out of the tree. And the consistency is a little bit oily, but it dissipates pretty quick. I started using it on these supposedly precancerous bumps on my forehead because the dermatologist wanted to burn them off, and they wanted me to use this chemotherapy type stuff. And I said, no, there's got to be a better way. And it is all but dissolved them. Also, I had like this bump on my cheek that just wouldn't go away. No matter what I did, would not go away. So I started putting it on that, and it's going away. Now I'm experimenting with, like you said, some skin tags or some other bumps. My mom, who's 81, she's like, I've got these things on my body. Everybody that I know is getting these melanomas right now. And I said, well, here, try this. and I would say you've got to give it a good, couple of months to let it work. But I think I've seen great success with it. So
Mhm.
if I had a dog and it doesn't
Mm-mm.
burn, it's not a
Mm-mm. I put it on my
chemical.
skin. It doesn't burn or anything.
Yeah. So again, we're not treating the root cause if we're just putting turpentine on a cyst, right? If that's what we decide to recommend or you decide to recommend. But again, you've got to look at what is the terrain. Because as we're learning, the body's always trying to heal itself, even in your pets. And these things are walling off toxins, right? That's it. Would you
Hmm.
agree with
Yeah.
that's the assessment of what's happening when a tumor forms or the cyst forms, that they're walling off something to keep it away from the rest of the body?
Yeah. And it's a sign of an imbalance. That's why you have to get to the foundation and be correcting the terrain and not just focusing on the lump, because the cyst or like a lipoma, something like that, they're not necessarily causing the pet any problems, but they're definitely a sign that something's out of balance. People say, oh, my dog, dog's old, it's getting these lumps. The lumps themselves might not be an issue, but it's still a sign of imbalance. As I said, I think lipomas are the same thing. The body, because toxins oftentimes accumulate in the fat and the body's walling them off. And I think we have to look at it as a sign of probably toxicity, and that the body is not able to manage the toxicity. We've been following the Bigglesons. There's all this stuff you hear about detox and what do I do about detox and detox protocols. And they're like, hey, if the body's healthy, the body knows how to detoxify. If you feel like your body needs help detoxifying, that's one thing. But to just automatically do, detox protocols, sometimes even that I think could be a band-aid, like you do that, but maybe I'm not eating quite as well and I'm not getting as much rest as I should. And I, could be doing other things. I could be, finding more joy, and they talk about all the time. If you're not correcting all of those things, you're like, well, I'm just going to do the detox, do a detox protocol and that'll take care of it. It's still just a band-aid. And I think to be really healthy, for our pets to be really healthy, we've got to get away from all those band-aids. And some band-aids would be considered quote unquote holistic or natural. I've
Right.
talked about doing coffee enemas. I used to do those regularly. They're like, well, if you feel like you need it, do it. But, like they say, that you don't see deer in the woods doing enemas or detoxing, you doing their juicing to detox or whatever. And I think their point is, if we're keeping the body healthy in other ways, the body can handle these things. So yes, you can use things as tools. I'm changing the way I'm thinking about this. Like, can use things as tools if it seems to be necessary. If you see a pet, it's got lumps, we know their body needs a little help detoxifying, then maybe some extra help detoxifying herbs, some milk thistle or dandelion to help support the liver in that circumstance. Sure, I'm not saying never do that stuff, but if we're just doing that routinely, then we're getting into, the pets that are on 10 or 15 different supplements all the time, just because it sounds like a good idea, where if we really just kept the terrain healthy, we wouldn't need any of that stuff. You have a whole lot of extra money to spend on raw food.
Right. And I'm changing the way that I think as well. Symptoms are the healing. Okay. And so, for instance, if we as a human are coughing, sneezing, have diarrhea, maybe even vomiting, though that is what the body must do to heal, right? That is what the body does to keep its terrain as good as possible. These are our natural abilities to heal. And what traditional medicine does is says, stop the symptoms. Okay, we're
Right.
just going to eliminate the symptoms. That's what this cough medicine does. That's what this pharmaceutical does. And it is uncomfortable, of course, right? Fever has got to be there in order to liquefy the thing, to get it out of the body, right? And so we have to really think about, do you really want to stop this symptom? Because the symptom, this is where, it's taken me a while really listening to it over and over again. The symptom
Mm-hmm.
is the healing mechanism,
Mm-hmm.
not, oh my goodness, my dog is sick. And the one thing that I really try to encourage our pet parents to do is stop using that word sick when it's just loose poops, when it's just regurgitation because maybe their digestion is not where it needs to be, or they've had too much bone, or who knows what it is, right? The body is just getting it out. That doesn't mean your dog is sick.
Right. I say, oh, thank God Rex just vomited, because there's probably something in there that shouldn't have been there.
Right.
And they vomit and then they're fine afterwards. Usually he goes and eats it. If he like swallowed something, like he's chewing on a treat, got a little too big of a piece of something, vomits it back up, he'll go grab it. He's chewing on it. He's like, well, that's where that went. But I'm like, that's great. It's good he vomited. Needed to get that out of his stomach. Like, that's a good thing. Now if your dog's vomiting every hour and they're so painful they can hardly move and they're not eating, that's different, because they
Mm-hmm.
can get things like foreign bodies and
Mm-hmm. Mm-hmm.
rocks and things and blockages, but that's
Mm-hmm.
rare, and that's severe. The average day-to-day stuff, that's just the body handling stuff. A little loose poop, a vomiting here and there. If they're otherwise eating and acting okay, they're fine. And I think, how many pets go in, they get put on, Serenia for vomiting and antibiotics for diarrhea, and then they just get sicker and sicker and sicker. It's really sad.
Yeah, and the no and my dog didn't eat. Well, when did he not eat? Well, just this morning. Okay, well, maybe they're doing a self-correction or a fasting, or maybe there's some pesticide that's being sprayed outside and you don't know about it. But I'll be very curious with Rex, Dr. JC, because I think that one of the things that we've seen sort of around that 7 to 8 month range, it seems like puppies um, stop eating and sort of recalibrate,
Mm-hmm.
right? And it could be that the pet parents have continued to feed the same
Mm-hmm.
amount, right, that they were feeding when they were much younger, and they're just not hungry. But in the next 4 months, it will be interesting to see if Rex does that. If he
Mm-hmm.
if he recalibrates, he stops eating, or what happens, because we see that a lot,
Mm-hmm.
and it's always between that 6 to 8 month range, I'm going to
Yep.
say.
Yep. I've seen that too. The older pups, and I think their bodies are changing, hormones are kicking in, they're not growing as fast. He's eating us out of house and home. He
I
just
know I just
eats.
packaged up your new order yesterday.
He eats so much. He eats so much. Plus, I've been freeze drying some for extra storage, just in case. Want to make sure that got dog food safe. But he's eaten a ton, but I've seen that in puppies. I've had people contact me concerned my dog's not eating, so go through the questions. Are they otherwise acting okay, doing fine? How much are you feeding them? And usually I say, well, just start feeding them a little less and see. Sometimes dogs that don't eat are just being overfed.
Right.
I've seen that. And especially little dogs, having had little dogs, I can attest to this. They will work the system. So sometimes, pet parent gets up in the morning, feeds their dog, they don't eat. An hour later, I'll offer them something else. I'll offer them something else, offer them something else. The dog's waiting for the next best offer, provided that there's no more, serious symptoms. But that type of dog, they'll usually eat at some point during the day. And the other key question I always ask is, when people say, my dog's not eating. So what exactly does that mean? Well, they're not eating in the morning anymore. Well, I always ask, is the dog losing weight? Because if the
Hmm.
dog's truly not eating, they're going to lose weight. And I've seen
Right.
dogs where people come to me and say, my dog's not eating, and they're actually gaining weight. So your dog's eating something. Like,
It's kind of weird. It doesn't work that way.
yeah. Now for some,
Yeah.
like some cancer patients truly not eating, those dogs are also losing weight. Those are the
Yeah.
dogs that'll come in and say, yeah, they've lost 15 pounds in the last month. Okay, that's true not eating. But for the dog that's maintaining their weight and they're just getting, a little bit more particular, then, I tell people, some dogs just don't eat in the morning. I've run into that a lot. I don't know if you have too. Like some
Yeah.
dogs just don't like to eat in the morning. They prefer to eat later in the day. So just feed them once a day later in the day. I don't know why, but it really bothers people that their dogs won't eat. I said, just feed them once a day, feed them later in the day when they tend to have the best appetite, because then that's what's most congruent with what their body wants. Their body doesn't want food first thing in the morning. So feed them later in the day, feed them one bigger meal and see how they do. The gut gets to rest all the rest of the time and just do that. But it's hard for people to, sometimes go down that road.
Well, again, because it's a dopamine hit for us.
Yeah.
It's a dopamine hit when we see that we're feeding our dog and they're loving it and they, will shake to get their treat or they'll sit up or they'll bark or they'll, what, you know what I'm saying? There's this transfer of interaction. There's this interaction that's going on with us and the dog. So it has, I think, more to do with that, with
Yeah.
us as a human being and the gratification that we get. Um, but again, just being conscious, just being aware of kind of what's going on, not doing these knee-jerk reactions, looking at symptoms as the healing mechanism, as a clue to what the root cause is, right? Again, who knows what is in the air? Who knows what is in the water supply? Who knows what is being sprayed on the ground, right? Who knows how the EMFs and the radiation and just the energy within the home is affecting the dog, right? There's a lot of things that are going on, as well as all of those pharmaceuticals. And people will say to me all the time, well, no, they don't get vaccines. They've just got the one. And I'm not sure why that statement is being made. Does your dog get vaccines? No, I don't vaccinate, just the rabies. And I'm like,
But you're
okay,
still,
so what you're
so
saying
you're
is,
vaccinating.
yeah, so you are vaccinating. Well, I have to. Well, that doesn't take away the fact that that's a vaccine. I
Right.
mean, you really have to kind of repeat it back, mirror back what they're saying. So, okay, you are vaccinating. Well, I had to. Okay, but the question is, are you vaccinating? Whether you had to or not, you
Right.
know?
And no matter what the reason is, you're still vaccinating and your dog's still going to have the consequences of that vaccine, whether or not you believed you had to, because there's no real have to. It is a choice.
I mean, I was talking to my mom and she was talking about this pit bull that lives next door. And this is a horrible pet parent, a really horrible pet parent. One pit bull is already gone because it had bitten 3 people.
Mm,
This one is the pet parent never comes outside and is constantly trying to get in my mom's backyard, who she has a little 5-pound dog, right? So she's super fearful of this dog. She has called and called and called. Police, dog, welfare, all this. Nobody will do anything. And I said, this is my point, Mom, about people that are afraid of the not getting the rabies vaccine. I'm like, you can't even get the people to come out when a dog is
yeah.
attacking people, much less they're going to come knock on your door and go, hey, can I see your rabies vaccination? So all of that fear is coming from what the veterinary community is saying, okay?
Mhm.
And the fact that you cannot do certain things, that is true. Daycares, boarding facilities, maybe even go in and have, just routine checkups done, which do you really need that? Um,
Right.
so there are those things. But if you really look at it, is someone going to come out and take your dog away? No, you can't
Right.
even get somebody to come out and deal with this dog who is a danger.
Right, exactly. And even if, I have had some clients say that their vet will tell them, I don't even know if the vets follow through, but that they will turn them in to the
Well, then
county.
don't go to that vet anymore.
They
Those
need a different
creeps.
vet. Totally. You need a different vet. But even if they did come out, they're not going to take your dog away. They're not going to euthanize your dog and check its brain for rabies. They might slap you on the wrist and say you got to do a rabies shot or give you a little fine or something. But like you said, these organizations are so overrun. I mean, municipal services, city services, I mean, people say they can't even get police to come out for car accidents and stuff. Do you really think they have the funding to be sending out, animal control officers about a claim that your pet doesn't have a rabies, I mean, it doesn't make any sense. It's just fear. And it's all created by the veterinary industry. And as like we talked about with the whole DCM issue, we
Mhm.
know how those things get started, and it's perpetuated in the veterinary industry, and they all say the same thing. So that makes it legit and valid and true. So, you gotta, start pushing back, or you just don't go in for wellness. The wellness exams are the worst. And, I never used to say this years ago. I would say, yeah, go in for the checkup just to make sure, take a look at the teeth and listen to the heart. But the wellness exams, I think, are the most dangerous to your pet, because they're the ones that are going to be pushing the vaccines, they're going to be pushing the heartworm and the flea and tick and all these things that you're doing on a regular basis that are actually poisoning your pet. If your pet's sick or hurt, I tell people go to the ER, because usually, I mean, they're not tied into the wellness. They're not as likely to push vaccines, and then you can say, well, I have another vet I deal with. Let's just handle this matter at hand. And so go just to the emergency clinics. And that's like me, like, I don't go to the doctor unless I have to. I mean, if I got in a car accident and broke a bone, I'd be in the emergency room, and get handled there. But I don't go in for like routine visits and stuff like that. So, kind of look at your pet's healthcare as more catastrophic. If your pet is sick or injured seriously, like may have a broken leg, or truly hasn't eaten anything in 3 days or something like that, then take it in. But take it to the ER, get the testing done, and then like we can still follow up. Like I can still help if you know of any other holistic vets. We can still help with the follow-up care after that. But yeah, it's really sad to say, but it's the wellness visits that are really killing the pets. I think it's the first time I've really said it that bluntly, but it's really true. It's really true.
Well,
That's where all this disease and imbalance is coming from. That's where they're selling the unhealthy diets and the prescription diets. And just don't tell them, don't tell them you're feeding raw, because then, they'll blame everything on the raw feeding. We've talked about that before, but yeah, avoid the wellness stuff, because that's where all the toxins come from.
yeah. And to work with Dr. Judy Jasek, you can go to ahavet.com, ahavet.com. I think it's well worth your time to get over there and establish yourself in her wellness group over there, that she can help you. Also, we would suggest that if you're open to it, to start reading some of these books. And the one from Dr. Daniel Roitis is Can You Catch a Cold? That's going to be a great one. And I do believe that it will alleviate a lot of your fears that you walk around in the world with. Okay. And it will give you another perspective to ponder. Okay.
Yeah.
To
And
ponder.
listen to multiple people. And like for me, like if I just hear one person say something that I hadn't heard, like I started listening to Dr. Cowan. I had never heard anybody say viruses don't exist before. He
Mhm.
was the first one. But then as you start to hear other people say it, number one is like, okay, so he's not the only one. But then different people kind of explain things in different, like I like listening to different people talk about the same topic, because they explain it in different ways. They have slightly different perspectives. They've got their own story on how they came to these conclusions. And to me, it really validates some of the stuff.
Oh, yeah. And I think that one of the people that I like the most listening to, because of the way he explains it, is Dr. Roitis. I really love the way he does it. And what's his name again?
Gober?
Gober,
Gober? I
Gober, like
pulled it up
goober.
because I couldn't remember. Yeah, Gober, Mark Gober. I guess he's written, and he's like, I guess I'm just getting old because everybody looks young, like I look at like, God, that guy looks like he's like 20, like, and he's written 5 books. Like, what have I done with my life?
You've been
Anyway,
saving pets.
he's probably 40, but anyway, he's written like a number of books on other topics, but he gets into the summary here, this is just off of my Audible. Consciousness creates all material reality. Biological processes do not create consciousness. So he's into the consciousness aspect of how we can create this, another whole, rabbit hole I've been getting into more, the nature of reality, that our consciousness and how we think about things can actually create what happens in our life. And I do believe that also influences our pets. So and I love the title of his book, An End to Upside Down Thinking, because isn't that just what it feels like? Like thinking is just upside down. Like I just want to tell, like, I want to just look at somebody and say, you're just upside down. You're thinking upside down. Like turn your thinking around. Like you're thinking upside. I love that book. I love that. I love that book title.
Another great book is Doctors Are More Harmful Than Germs, which this is going to be a great book. It's from Dr. Harvey Bigelson, which talks about, it really goes into depth about germ theory and why it can be so dangerous. I think, Dr. Jasek, if the following the germ theory has allowed the poisons to be put in dogs, cats, horses, people. I mean,
Yeah.
it really
If you think
has.
about it, if you just change the way you think about things and go more terrain than germ, then if you really believe that way, you're not going to do these things. You're just going to look at health a whole different way, and you're going to get out of the fear. And I think that's really what needs to happen. Because you think your dog wants to go to the vet and get all those shots and all those medications and all these toxins put into its body? Heck, no, it doesn't. That's all the human fear, because you're the ones paying the bill. So they're marketing to you and they're feeding you with all this fear.
Yeah, and a really good book is going to be this one, The Final Pandemic. They do address in here the thing that we're facing right now, the bird flu. Okay.
Yeah.
And you know what's going to happen, guys, is that they're going to kill millions of chickens. They're going to kill cows. This is part of the agenda. And then you're going to turn around and you're going to say, why is my food bill going up?
Yeah, right. If you can even find food.
Right. And so we've got to be aware of what the game is so that we can recognize it, so we can not be afraid, so we don't take the steps to assist them in their fear mongering and in the decline of our health and our pets' health. It's really, really important. And I knowledge is power. Right. And to be distracted all the time, to not know what you're thinking, to give away your power just because somebody has a look of authority, right, is not where you want to be. You want to have that power, not in an aggressive way, Dr. Jasek, but in a calm knowing, not a belief, a calm knowing, because you've had experience with it. You'll be led to those folks that help you make those connections, that where you can connect this dot to that dot to this dot to that dot.
And then you're not going to be in fear, and you're not going to make these knee-jerk reactions that you make when you're afraid.
Right. And so start to question, why would things be censored? Why would insurance companies not provide holistic health care? Why do they not pay for holistic health care? Does that even make any sense? That insurance companies will only pay for the traditional medical protocols. That right there, that one right there should wake everybody up and say, why wouldn't they do that if it helps? And so then the natural thought pattern, I believe, that they're trying to establish is, well, that doesn't work. Therefore, you must come over here to the medical establishment. No, it's a captured industry.
Right, exactly. Because I mean, you think about it, if you do the things that are going to keep like healthy food, that are going to help keep a pet healthy, they don't need all these drugs. They don't need these other treatments. It would save the insurance companies tons and tons of money in payouts, but they don't do that. So yeah, what possible reason could it be? Because yeah, they're in cahoots with the medical industry. We had a client that filed with her insurance company with one of our consults, and as part of our new client consults, but part of it's a nutrition consult with Karen. And we kind of break that down on their invoice. They would not cover that piece. They would cover the medical consult, but like, we don't cover nutrition consults. You know, the one thing that's going to do the most to keep that pet healthy, but they won't cover it. No, we don't cover nutrition consults. So there you go.
Well, your traditional human doctor, do they do nutritional consults? And if they don't, I would ask them why. Next time you guys go into the doctor, ask him, how come you don't do nutritional consults?
Yeah.
Do you
Because they
get
don't know
paid
they
on
don't
those?
know they don't know anything about it, for one.
That's true. That's true. But you have to ask the questions just to flesh out that that they know that that they don't know.
That they
I
don't
mean,
know. Yep.
and that's always the thing, is to ask that question. Somebody the other day, who it's really strange, because somebody can be halfway into the holistic aspect of life, but then they're still in that germ theory. Right.
Mhm.
And so somebody said to me the other day, and this person, was into all this holistic stuff, but she was talking about somebody, and she said, and people are just unconscious. And she said, they're just like coughing. They don't even cover their mouth, and they're spreading disease everywhere. And I said, oh, okay. Yeah, you're in the virus camp. And of course. And I said, well, I love that. I love that you're in the virus camp, because maybe you are the person that could lead me to the actual studies about, the isolation of the virus. I've not yet been able to find those.
Right.
They don't want to talk to me anymore after that. But,
No.
asking that question, right? You want to ask that question. And you can ask it in that very way that's non-threatening. It's like, great, you're the person I need to talk to, because obviously you're very educated in it. Where are those studies? I can't get my hands on them.
Yes. I love that. I'm gonna have to use that line. That's great. Yeah, yeah. And there's never been proven that viruses exist, never been proven that contagion has never been proven. It has never been definitively proven that one person or one animal can actually spread a germ to another. It's never been definitively proven. Yes, you can have common exposures to things. There can be common toxins, common environmental influences that might show up in similar ways in different individuals, but true contagion has never been proven.
Has been written by Dr. Thomas Cowan in another great book, The Contagion Myth.
Contagion myth, yeah.
And there's several books out there about, contagion. And I've had Don Lester and David Parker on. What Really Makes You Ill is in this big
That
old
was
book.
a great, I listened to your podcast with them. That was awesome.
Yeah, I just did another one with David on the nature of reality.
Oh, did you? Oh, I'm gonna have to listen.
Now, I
like
haven't
them a
put that
lot.
one out yet, because they're lovely. David came on by himself, and he actually said, "Look, I'll come back anytime and we can discuss rabies, because they've gone in depth. We can discuss candida, we can discuss, bacteria, we can discuss Lyme disease, all of this kind of stuff, and vaccines, they've done a whole deal on." But we went down the rabbit hole of the nature of reality, and I was a little bit out of my depth there, but I am going to put that up. And that's a little bit outside of, talking about, we did talk about pets in there, and he did talk about, the things that we believe that aren't true, right? And what is a belief? So anyway, I'll get that one up. It'll come out next week. But because they have that book, The Nature of Reality.
Yeah, I actually read a reading. I'm almost done with it. It's a pretty quick read, their Nature of Reality book. Because that's really interesting to me. This whole idea that you can create your reality. It's not like that's a new concept to me, but the fact that we can really create everything around us, and everybody, where I have a hard time getting my head around that, is if we're all creating our own realities, but then how is it that our realities, intersect? Because I'm creating this reality, but then like the CEO of Pfizer wants to create this reality where he's making billions of dollars selling vaccines. So how is it that all those realities exist like simultaneously? That's a little hard for me to understand, but I think it's a fascinating topic.
Well, he did say something to me that was interesting on that podcast where I talked about the frustration that you and I have when pet parents come to us and they're doing all of these poisons and they feel that the diet is not correcting it, but yet they're doing all this stuff. He said, well, why don't you create this reality where you only have people who don't do that in your client base? I was like, huh? I could do that? You know what I mean? So he was saying that. He was like,
Yeah.
why don't you just create that to where that brings you joy, that you're not having to bang your head, against the wall and fight against the traditional way. You're actually helping people, right? They're open to it. You're helping people see that the poisons aren't the way to go, instead of having those people that want to fight you on that. So I thought
Yeah.
that was an interesting concept.
Maybe interesting. So set that intention every day. I'm only going to attract people that are, you know, like-minded and don't want to keep poisoning their pets and try to create a different reality. Be worth giving a try.
Right, right. And I think it's more for me is just getting in the feeling. What feeling do I want to have
Mhm.
every day? What do I want to create? And then not getting the specifics. Now there are people that had subscribe to the vision boards, and you're creating the exact thing. And I think those vision boards, at least for me, are more about the feeling it can create. I have no idea how that will manifest itself, right? It
Mhm.
could be totally different. Um, but I will say this, and I've talked to you about this, that because we have a family member that's dealing with a cancer diagnosis, I have been every day for the past 8 weeks saying, let me be that vessel for that information, that I can give them this information that will be helpful to them.
Mhm.
And I've even been specific, which I in what I need. Like I need somebody to help me understand the emotional component of cancer, right? And I'll be doggone, I get that
Mhm.
answer every single time. Every single time. Now, when I'm looking at, all right, why am I having hot flashes and what can I do naturally to help me stop? Maybe I'm not doing that as well for myself. I can certainly do it for somebody else, maybe because I'm not as attached to it, right?
Right.
But
Right.
but I will say, I've even talked to Neely about it and you about it. I'm like, am I crazy? Because I'm getting these answers.
I don't think it's crazy. Not at all.
It's how I found the Bigglesons.
Yeah. I
I
don't
was
know.
like, I didn't even know who they were. And then from them, it was like all of these other people start popping up and we start seeing all this stuff. And it's wild. So I do think that it's not as if you're magic, right? It's that things are here. We just don't see them until we
Right.
allow ourselves to see them.
Right. That's the whole, like, really the nature of reality thing, is that everything is there available to us. The universe is, all knowing, has all the information, everything you need is out there, but our current perception is very narrow. What we perceive at any one point in time is very narrow. So I think setting your intention is just is like opening that scope. Like, it's kind of like, help me see something different that I'm not seeing now, is kind of the way I look at it. And then when you're open to it, then you allow more to come in. If you just keep your narrow tunnel vision, like people that are like, oh, there's germs and viruses and I'm afraid and this is the only way I can treat my pet, you're not allowing other information to come in, and be open to however it shows up too. I think you say, like, this information to come in, I don't know where it's going to come from, but you just open yourself up to it, and then you allow more of it to come in. I was reading a book once, a lady that had a near-death experience, and she described that time where she was like kind of between life and death, and like kind of deciding whether she was going to come back or not. And she said it was like you're in a big warehouse and you've got a flashlight, and like all you can see in the physical world is where that flashlight beam is. But then when you're on the other side, somebody turns all the lights on and you can all of a sudden see everything. It's just, you're just so aware of everything that's really out there, that our conscious focus is just still so narrow. So it's just a matter of opening up your focus. And according to people like Don Lester and David Parker, like, we can do that. It's just not a skill we've been encouraged to develop here.
Right. I love that. I love that analogy, and that's very helpful to me. And the other thing too is we are not alone, right? So we feel like we are totally alone and not connected. And once I started getting sort of that idea in my head that I'm connected, like aspen trees, or they talk about fungi, like mushrooms and things. Their roots, they go way out and they're all connected, and they're sort of this I don't know that they all communicate, right? And so I think that has helped me as well to say, okay, I have no idea who hears me. I have no idea what it is. I don't have to really know. I just have to be open to it. And I get those answers back. There's a really funny thing that I do. So we walk this circle we have a big circle. Everybody walks in this neighborhood. And there's a small circle and then there's a large circle. And there's a lady that has this camper or an RV. She has the small drivable RVs. And we were talking to her one day, and her husband has passed, and so she wasn't really sure she wanted to keep this RV. And I really love it. And so every day that we walk and we pass her house, I say to the house, to the area, "Hi, just wanted to let you know, if you're interested in selling your RV, we may be interested in buying it. Thank you for bringing us joy." And I walk on and I say it every single time, and my husband laughs, but I just do it. I don't
Well,
know why I
yeah.
say that. I've always done this thing where I say, "Thank you for bringing us joy." And I do it every single time we stay in a hotel or a VRBO or wherever we stay. Once we leave the room, right before we leave the room and we close the door, I always say, "Thank you for bringing us joy." I don't even know where that came from, but I've been doing it for years.
Yeah.
And I don't know why, but I just do it.
Well, gratitude's very powerful, state of mind or place to be in. Like, it's supposed to be the place to create the best is when you're in a state of gratitude, and even being grateful for things before they appear. Like, I'm grateful for this wonderful RV that we have that brings me so much joy. You're already grateful for things, and that actually helps with the creation of what we want to manifest.
Yeah. Well, I'm grateful for you, Dr. Jasek.
Oh, I'm grateful for you too, and all the great food you send to Rex.
Well, we'll be watching Rex and see if our theory plays
Yeah.
out in Rex in the next 4 months. We'll see how he does. And you guys get over and work with Dr. Jasek at ahavet.com, ahavet.com. She can Zoom with you anywhere you are, give you a different perspective. If you have a cancer diagnosis, that she can certainly help you in that realm as well. If your dog is just not doing as well as it needs to. Again, this is a raw feeding, truly holistic medical doctor. Okay. And you don't find those. very often. So you want to get over to ahavet.com. Remember, you got to get your dog off of a processed food. You want to make sure that there are as few ingredients in the blends that you're feeding as possible. And we can help you do that. Brian is now doing free 20-minute consults. So you can sign up with Brian to help you pick out the blend, to help you figure out whatever you need in bones or treats, size of your dog. He loves that. He's really good at it. So you can get over there and work with Brian today. Okay, that's at rawdogfoodandco.com, where your pet's health is our business. And what, Dr. Jasek?
Friends don't let friends feed kibble, y'all.
That's right. Thanks so much. We'll see you guys next week. Bye-bye, everybody.
Bye.